Good evening and welcome to the final session. Well, it's not really a session, it's just my summary talk of the Australian Dementia Forum 2021. From where I sit, it's been an extremely successful meeting, and I hope you agree. I hope you've found it enjoyable and informative and felt part of the dementia research community. I'm just going to quickly run through what I think now were the big themes of this conference and a quick summary, first of all, of today's plenary speakers, as I did yesterday. So we started from San Diego in the United States, giving us a wonderful update on clinical trials and where they're at. He told us about the initial push for following the cholinergic hypothesis in the 1980s that resulted in Aricept and other therapeutics, which have mild to moderate benefits for patients with cognitive impairment. We then saw a push for therapies based on epidemiological targets, which unfortunately were largely unsuccessful. And now in the era of chasing targets, and have been for some time, targets based on the pathology, so amyloid plaques, tau tangles, and neuroinflammation. And despite a decade of failures, as Paul stated, we now seem to be poised for success. There are 4 anti-amyloid antibodies that have been shown to effectively remove amyloid plaques, and they have also all shown a slowing in the rate of cognitive decline. Excitingly, we are moving into prevention of dementia by treating during the preclinical phases of Alzheimer's disease. And the AHEAD A345 study is currently launching in Australia. Now, Australia and ADNET now have been heavily involved in these trials. ADNET is assisting particularly in the recruitment for the A345 study by screening patients at sites in New South Wales, South Australia, Victoria, Western Australia. Shane Littlelow, the Aussie, now living and working in New York and working at New York University, spoke to us about astrocytes. Astrocytes are so essential for healthy neurons, for building synapses, for recycling of neurotransmitters, for maintaining the blood-brain barrier, and for having a role in the immune function of the brain. Microglia, which are the primary immune mechanisms of the brain, though, can induce astrocytes to become toxic. They can produce a neurotoxin that causes apoptosis or cell death of neurons. One possible therapeutic application in neurodegenerative disease then is to block these activating factors. And Shane and his group, through their advances and major improvements in methods to study reactive astrocytes, are leading the way in this sort of development. As I predicted this morning, Eddie Strevens tormented us that are locked down on the first day of winter in Melbourne with pictures of sun, blue skies and aqua seas and the Torres Strait Islands. But more seriously, he gave us very clear insight into the health, mental health, general health, and dementia risk for Aboriginal and Torres Strait Islander inhabitants, persons. It was interesting to learn that while ATSI persons are quite capable of living to a very old age, unfortunately, they have a dramatically lower chance of getting to the age of 65 overall than non-Indigenous Australians. It's pleasing to see that this is improving, but that in turn means more ATSI population are getting into the older age group, and we see dementia increasing, which appears to be approximately 4 times higher than in the non-Indigenous Australians. Interestingly, vascular risk factors and not alcohol seem to be driving this problem, so there's real potential for effective intervention. Eddie and his group, and others of course, have been looking at strategies to improve research and uptake of recommendations in these communities. Rolling engagement rather than hit and run research has to be done to be successful. Telehealth research is promising. but the research has to involve the community and be developed and designed with the community heavily involved. Dag Arslan gave us an excellent talk on the neuropsychiatric aspects of neurodegenerative disorders. I was a little surprised to see how common these are, even in the mild cognitive impairment phase of cognitive decline, where depression and apathy are extremely common. He pointed out that treatment of pain, delirium, and person-centered care is often more effective and much safer than antipsychotic medication to reduce behavioural disturbance. He did point out that there is some hope on the horizon for medications. Pimavanserin appeared to be quite effective in reducing psychosis, although it has not been FDA approved, and more trials are underway to meet the requirements of the FDA. Cannabinoids are under investigation for treatment of agitation, and other medications as well, certainly in trial, that are likely to assist with the management of BPSD. So they were the plenary presentations. Now, my take of the big themes of our conference. Well, I think addressing treatable risk factors for dementia, this was very big. 40% of dementia cases appear to be contributed to by these preventable risk factors. And one that created a lot of discussion was hearing and the need to wear hearing aids. We don't quite understand the mechanism of this, but evidently the numbers are pretty impressive, and certainly the outcome is much better amongst those that wear their hearing aids than those that don't. Blood biomarkers were the next big area of interest. Neurofilament light and GFAP as markers of neurodegeneration, and then the more specific markers, A-beta-142 and phospho-tau for amyloid and tau for Alzheimer's disease. These are looking like they really are working well and should become widely available, I think, within a few years. There's a lot of excitement about the anti-amyloid therapies, both in early Alzheimer's disease and in the preclinical stages. We're making steady incremental progress in understanding the biology of the dementias, and I was very pleased to see the breadth of basic research being done across Australia. We're finding better ways to implement better care of persons living with dementia. This is badly needed because, as one example, there is little evidence of impact of the recommendations for the better treatment of BPSD to reduce excessive medication use. We don't seem to have really made much impact on that at this present time, despite the evidence being fairly overwhelming. Online cognitive assessment was another topic of much discussion. This seems to be improving, but we do have to remember that older persons still prefer face-to-face assessment and that personal human contact. I was pleased to see ADNET, some of the output of the Australian Dementia Network, starting to now filter through into research presentations on the clinical quality registry, on the memory clinics, development of guidelines, improving access and education, and how the trial screening program is now starting to increase the availability and access to really cutting-edge treatment trials in Australia. So just a few final things. There is a feedback survey that you will be receiving. I would greatly appreciate your thoughts on this meeting and how to improve it. The presentations will remain online until the last day of July. So you have plenty of time to go and see those sessions that you missed. And certainly there's a lot of content in this forum, and I certainly have got a lot more to go and look at yet. So on that note, thank you very much for attending, and I look forward to seeing you at the Australian Dementia Forum in 2022. Thank you.